Let's be honest, breaking a bone is never on the to-do list, right? But a broken wrist, that's one of the most common injuries you can get. Now, you'd think the path to recovery is obvious. Get a cast, then get physical therapy. But what if the science tells a different, and honestly, a much more empowering story? Let's dive in and see what the research actually says.
Okay, first, let's get some perspective. This number, 16%, that's the slice of all fractures that emergency departments see that are what doctors call distal radius fractures. In plain English, it's the classic broken wrist. It's a break in that bigger forearm bone, the radius, right down by your hand. It's an injury that happens to people of all ages, from all walks of life.
And this brings us to that huge moment. After weeks of being stuck in a cast, it finally comes off. Your wrist feels stiff, it's weak, and frankly, it's a little scary to even think about moving it. So what is the very next step on that road back to normal?
The fact that this break is so incredibly common is exactly why we need to understand the recovery process. Millions of people every single year find themselves in this exact situation.
The conventional wisdom, the stuff we all assume is true, points in one very specific direction. But as we're about to see, there's a fascinating study that really challenges our basic assumptions about what the best recovery plan really is.
All right, let's start by looking at the standard playbook. What are the typical steps that most patients are told to follow once they are finally free from that cast?
So the medical game plan is usually broken down into these three logical stages. First, you've got to control the swelling, that's the edema, often with a splint. Then it's all about mobilization, gently, carefully, getting that stiff joint moving again. And finally, you get to strengthening, building back all that muscle you lost.
And to get through those stages, the default move for a lot of doctors and health systems is an immediate referral to a physical or occupational therapist for a bunch of supervised in-person sessions. But is that always the best or even necessary path?
This is where the science gets really, really interesting. Some researchers decided to put that exact question to the test. They basically set up a head-to-head competition between different ways of doing rehab.
A team over at the University of Nottingham in the UK designed what's called a randomized controlled trial, which is pretty much the gold standard in medical research, to compare three super common approaches for patients right after their casts came off.
So, let's meet our contenders. In one corner, we've got Team Leaflet. These patients were just handed a simple printed sheet with 7 exercises on it. In the second corner, we have Team Video. They got a link to a video showing them how to do the exercises. And in the third corner, Team In-Person, the traditional route, with supervised face-to-face therapy sessions.
Okay, so the stage was set. Over 100 patients were randomly put into one of these three groups, and the scientists tracked their progress over time. And let me tell you, the results were not what most people would have guessed. So, the big question is, which approach came out on top? Your first guess is probably the high-touch, in-person therapy, right? That it would have a huge advantage. Well, the data tells a much more interesting story.
The main thing they measured was something called the DASH score at 6 weeks. It's basically a questionnaire where people rate how well they can do daily tasks. For this score, lower is better. And just look at that. The bars are almost identical. All three groups, Leaflet, Video, and In-Person, reported pretty much the exact same level of function.
Let me just say that again, because this is the headline. When you look at overall wrist function, pain, and disability, there was no statistically significant difference between getting a simple leaflet, watching a video, or going to a bunch of formal therapy sessions.
But, good science is all about the details. The researchers dug a little deeper into the data, and they did find one specific area where in-person therapy seemed to have a slight, temporary leg up.
When they looked specifically at work-related tasks, the group getting face-to-face therapy did report a bit less disability at the 6-week mark compared to the folks with just the leaflet. But here's the real kicker. By the 1-year follow-up, that advantage had completely vanished. All the groups were right back on equal footing.
So what do we do with this information? I mean, was this just some fluke study? To answer that, we really need to zoom out and look at the whole scientific landscape for fracture rehab.
It's a totally fair question, right? It feels a little crazy that a single piece of paper could go toe-to-toe with the hands-on expertise of a trained therapist. But the answer, it turns out, lies in the overall state of the evidence.
Check out this quote. It comes from a massive overview of all the systematic reviews on this topic. And what it says is pretty shocking.
After looking at all the collected research, they basically found that the evidence for any single rehab program, being the undisputed champion, is surprisingly weak.
So, that study from Nottingham? It's not an outlier at all. Its findings actually fit perfectly inside this bigger scientific picture. It seems there isn't a clear winner, because maybe the secret ingredient isn't the method itself, but just the act of doing it. Consistently doing the right exercises on your own can be just as powerful as having someone guide you.
And this all brings us to the most important part of this whole explainer. What does all this science mean for you, the person who actually has the broken bone?
Okay, so let's boil it all down. What should you take away from this? First, for most people, a simple do-it-yourself rehab program can be just as good as formal therapy for your overall recovery. Second, this really suggests that what matters most is your consistency with the exercises, not so much the format you get them in. Third, if your number one goal is getting back to a physically demanding job as fast as humanly possible, in-person therapy might give you a little short-term boost. And finally, and this is the big one, you have options. This is not about saying physical therapy is bad. It's about being empowered with the knowledge that there are effective, scientifically backed alternatives. It's a conversation you can and should have with your doctor.
Ultimately, all of this research points in one direction, toward more patient empowerment. It suggests that for a lot of common injuries, the power to recover and to do it well might be a lot more accessible and more in your own hands than any of us ever thought.